Right, this is our 2-month-old male with no past medical history who presents in the emergency department today. Status post a fall from his bed. The report is given by the mother who laid the patient on the bed that she reported it to be 3 to 4 feet off the ground. She turned away from the patient, and when she turned back around, the patient had either rolled off the bed or somehow fallen off the bed onto the ground, which is a hardwood floor. She said that when the patient fell, that he fell onto his face, mainly his forehead and the front side of his body. He immediately started crying, and then she noted a little bit afterwards him starting to become more sleepy. This all happened about 1 hour ago, and the increased sleepiness, it worried the mother, and that's why she brought him into the emergency department. The mother reports the patient has had no other reports of fever, vomiting, diarrhea, cold-like symptoms, nasal congestion, cough, that he has no other past medical history, like I said, no past surgical history, hospitalizations. He was a normal delivery, vaginal birth, went home, did not have an NICU stay, he was full term. He does not take any medications at home, he has no allergies. Mother also reported that she didn't note any seizure-like activity, shaking, or trembling at home as well. In the review of systems, mom said that he has been alert but seems more sleepy than usual. His head, she didn't note any bruises or trauma, notable lesions to the head at all. His ears, she reported no drainage redness. His eyes are clear, no drainage redness. Nose, like I mentioned, no rhinorrhea or drainage, nasal congestion. And throat, no lesions were noted or cough. Respiratory, he has been unlabored breathing at home. Cardiac, no cyanosis. GI, he is breastfed. She did not feed him today since the episode when he fell off the bed, but he did feed this morning when he woke up. No reports of diarrhea or vomiting, as I mentioned. GU, he does void to diaper, no decrease in wet diapers. Musculoskeletal seems to be moving all his extremities appropriately with good passive and active range of motion. And neuro, she did mention the increased sleepiness, no seizure-like activity, and otherwise seems to be acting himself. On exam, the patient is alert and does arouse appropriately with stimulation. He is well developed and looks neurologically appropriate and developmentally appropriate. He does track and follow you around the room. Head, it is round on exam. On palpation, we did not palpate any fractures or abnormalities in the skull. Eyes are clear, no redness or drainage. Ears, on the outer portion, no redness or drainage there. Nose, we did not see any rhinorrhea or nasal congestion, and for his throat and neck, it does look supple. Respiratory, he's on room air, non-labored breathing, no respiratory distress. Cardiac, he is warm and well perfused. GI, his belly is soft and seems non-tender. GU, I did not examine this part, he is voiding to diaper. Musculoskeletal, he has good active and passive range of motion of all of his extremities, good strength, no joint swelling or any injuries to the extremities. Skin, no rash, bruising noted on exam. In neuro, he is arousable with stimulation, appropriately cries, and then soothes himself with pacifier, has good suck reflex, as well as a good startle reflex, and his fontanelle is soft and flat. His eyes are brisk, equal, round, and reactive to light. So this is our 2-month-old male who has no past medical history, presents to the emergency department with a fall from the bed. He is neurologically stable. Our plan for him is to get a head CT, and along with the head CT, the emergency department ordered a x-ray of his C-spine. The head CT did show no fluid collections, no fractures, and his ventricles are of normal size, and the C-spine looks stable on the x-ray with no fractures or subluxation. We'll let the trauma team do further management. We do recommend that the patient stay for some observation, but we do not feel that he needs to be admitted. He can eat and drink as tolerated, activity is tolerated, and we did remove the C-collar this morning on our exam. And then social work was consulted just per the trauma policy. Thank you.